Hi, I'm Dr. David Rogers, and I've been in practice in Waukesha for 22 years. Well, I became interested in medicine at a fairly early age. My mother was a labor and delivery nurse, and so growing up in our household there was always talk of medicine. And my father was a teacher, and my earliest memories are of him as a high school biology teacher, and then as I grew older he became a college professor and taught at Purdue University in anatomy and physiology. And so I was sort of a blend between those two, and I see that in my practice because when I take care of a patient, I feel the urge to educate them, to tell them about their disease, make sure they understand it. And then that helps us with the treatment of the patient, because when a patient understands what's going on, then they become a better patient and we get better outcomes. Well, my approach to providing quality care is to approach each patient as an individual. I look at the doctor-patient relationship as somewhat of a team. The patient needs to be engaged, they need to be involved in their care, they need to know what's going on with them. I need to be somewhat of a coach or a teammate for the patient to provide oversight and direction. The reason I feel that that's the best approach is because we end up with the best patient outcome, and that ultimately is the goal. On the personal side, I've been happily married for 29, going on 30 years. I met my wife when we were in actually elementary school. We have 2 grown children, a daughter who's a freshman in medical school and a son who's a freshman in college. Sports have always been a big thing for my wife and for me. Our children were very active in sports all through high school and at the college level, so we've done a lot of sports spectating over the past 12 years. The best part of my job is the patient contact. I like talking to patients, I like listening to what they have to say. I like the diagnostic challenge of, after putting together the facts, trying to come up with an accurate differential diagnosis, and then implementing a game plan, a treatment plan, and seeing it through with the patient.